He's a preacher.
He is also one of the most compassionate people.
I'm like one of his disciples.
He's just a loving, warm, facilitative, catalytic, amazing man.
He has this welcoming energy that just brings you in.
And he just gets this smile, this warmth.
And you're almost powerless to resist it, and you don't want to resist it.
I always think of Arnold as Papa Arnold.
Arnold is that cool uncle that I wish I had.
He actually looks like my grandfather.
I didn't know anything until I met Arnold Perkins.
I joined the public health department because of Arnold Perkins.
Arnold got into public health when he owned a cafe that was near the health department.
I opened a business, a coffee and sweet shop, that I did for maybe 3 years.
When he had that cafe, he was approached by Dave Cures.
He was the head of the health services agency in Alameda County.
He approached Arnold, who had no experience and no training in public health.
I said, I don't know anything about public health.
But who was really connected and really understood community.
He said, well, you know about people, that I do, and you know about organized, that I do.
And he convinced Arnold to come and work for the health department.
But he didn't tell me I was going to be the public health director.
When he came to the public health department, he had this big afro and this dashiki on. And I said, our director, this is gonna be interesting.
Arnold wasn't a public health guy. He was really proud of that.
We had this planning process that drove some people absolutely crazy.
Arnold's job was to put the public back in the public's health. And he took that very seriously.
He helped change the culture.
The process was no definitions, no discussion of money, and to play with toys.
Arnold was always open. You know, it was great working for him, but he always pushed you.
Arnold used to bring us all out into the community and tell the community folks, you are our boss.
He made us ride the bus around Oakland to see how people got around, to understand how people communicated with each other.
He would make us spend time with police officers in some of our most disinvested communities.
And to hear testimony and to actually develop a relationship and a better sense of what's actually going on.
It's those folk who live in the West Oakland community that will change things, not law enforcement, not public health.
We are stewards of our communities, and we need to think about how we use our resources in ways that really promote health for everybody.
That interpersonal relationship helped people reaffirm their spirit and a sense of being valued and feeling loved.
He recognized that you know, we had to change the hearts and minds of all of our staff and engage our staff in these change efforts.
I wanted the folk to understand, number one, that they work for the residents of Alameda County. They did not work for the Board of Supervisors. I never worked for the Board of Supervisors.
He dismantled a rigid, resistant, recalcitrant bureaucracy in the public health department and made it relevant to the communities that it ostensibly serves.
To really push the boundaries and really go up against power and political power. It's the sign of a true visionary.
That had a lasting impact.
I grew up in the segregated South. No Jews, no niggas, no dogs, and then no niggas, no dogs, and then no niggas. One drinking fountain had cool water, and it maybe said white, maybe it didn't. Another one, you had to bend down at the waist to drink from, it said color. My father never allowed me to drink from any of the fountains because I will not allow you to bow down to this society that treats us unjustly.
Movements are started by touching the heart and getting our emotions kind of moving, and Arnie has been able to do that with this subject of health inequity.
It's the inequities that create the disparities.
One of his famous lines that everyone's going to repeat.
I'd rather you ask for forgiveness than ask for permission.
It made me feel personally that I couldn't make mistakes, I could take risks.
If you don't stand for something, you'll fall for anything.
He's not the kind of person who takes no for an answer.
No does not move you forward.
There's so many, I should write them down.
The past is history. The future is mystery.
The tallest blade of grass needs to bend the lowest.
If you want to have what you've never had before, you must do what you've never done before.
Because of Arnold's encouragement and inspiration, we felt unstoppable.
You either say you can do it and you carry it out, or say that you can't do it. But you can't fake the funk.
Everything he does out of love.
I have a gratitude attitude. I'm so thankful.
He inspires greatness in other people.
He was one of the very first public health leaders to blaze a new trail for those of us that followed here in public health.
It is all about who you are and what you do.
I honestly believe that our Office of Health Equity would likely not exist if it wasn't for legacy builders like Dr. Arnold Perkins.
Arnold Perkins is a global ambassador for health equity and for humanity.
Arnold Perkins embodies health equity, and he embodies a health equity practice.
You've been a friend to many of us. You've inspired us, and you've irrevocably changed public health in the state of California.
Arnold, I just want to thank you. You will continue to be an inspiration for me, a role model, a mentor, a soulmate.
So that's why we are naming this award the Arnold Perkins Award.
I love you, man.
Thank you.